Given the results of a specimen stain, we listed the most likely organisms present in the specimen, and we described the basic process of microbiology testing for identification and susceptibility. Now, let's identify the normal human flora and the role in infectious diseases. Let's take a look at the terminology of the human microbiome. The term microbiota in general refers to the collection of all living organisms present in a specific ecosystem or environment. In human microbiota, we're specifically referring to all living organisms, including bacteria, fungi, phages, archaea, and protists that live in the body. And we are specifically talking about these organisms that are not necessarily causing an infection, so these are a normal part of the human health. The term microbiota specifically refers to the fungal component of microbiota. And when we say all living organisms, it essentially does not include viruses because viruses are not considered living organisms. The term microbiome specifically refers to the combination of the microbiota together with the elements that are crucial to their function, including the collective genomes of the microorganisms present. So if you can think of the human genome, which is essentially the genes from the human DNA, so the human genome is around 23,000 genes. When we compare that to the microbiome, the genes present in microbiome are estimated to be somewhere between 3 to 10 million genes up to over 200 million genes. And there's a large variation in this because of inter-individual variation in the microbiota. But that tells you the essentially the scope of how many genes the microbiome contributes to the human health. And because living organisms do not include viruses, there is also the term virome, which comprises bacteriophages or phages that infect bacteria, viruses that infect other cellular microorganisms such as archaea, viruses that infect human cells, and viruses present as transient in food. Let's take a look at the development of human microbiota. So we start at the beginning of life. Although there is debate regarding the existence of the placental microbiome, the current consensus is that the healthy placenta and fetus are devoid of microbiota because of the immune system's effective sterilization, thereby preventing colonization by microbes. In fact, the presence of bacteria in the amniotic fluid contributes to premature birth. Now, upon birth, this is where the human microbiome starts to develop. The first 1,000 days are crucial in developing a healthy microbiome. So that's essentially about the first 3 years of life when the microbiome gets set for life. And of course, throughout life, there is variation to microbiome. It is essentially affected by lifestyle, diet, and other things such as drugs. At birth, through vaginal delivery, the baby will be exposed to vaginal microbiota, hopefully a healthy vaginal microbiota, which includes lactobacillus species. And this is the first opportunity for the microbiome to differ in persons when you consider babies that are born through a cesarean section. They will essentially be exposed to bacteria from the skin. And this is skin microbiota that are representation of the bacteria in the operating room when where the C-section is done. Now, upon birth, whether through vaginal delivery or C-section, other things that affect the microbiome early in life includes whether the baby is breastfed or formula fed. Human milk has probiotics naturally, so it has bifidobacteria and lactobacillus, whereas formula, it depends on which formula people use. They essentially have to mimic a normal microbiota. Essentially, the consensus right now is that breastfeeding is much healthier for developing a healthy microbiome, whereas formula feeding deviates from a natural microbiome development. Now, when it comes to infectious diseases, it is helpful to know which sites in the body are sterile. So essentially, in general, it's considered that all internal organs are sterile. So organisms are not supposed to be there. So for example, blood is considered sterile. So if you have a healthy person, if you take their blood sample and culture it, nothing should grow. The same is true with central nervous system, cerebral spinal fluid, or CSF, liver and spleen. In fact, the liver and the spleen have a role in clearing the blood and catching if organisms are, if bacteria make their way into the blood, the liver and the spleen have a role in clearing them. The kidneys are supposed to be sterile, and the lower bronchi and alveolar are considered sterile. And there's a question mark here. It's a matter of how deep you go into the lungs, because there is a lung microbiome. So it's a matter of how deep you go into the lung. And bladder, for some individuals may have bacteria present in their bladder without having an infection. But early in life, especially younger men, essentially have a sterile bladder. But as people get older, especially older men are likely to start to have organisms in their urine. In women throughout life, although many women have a sterile urine, it is not uncommon to have women have organisms as part of their urine microbiome. Now let's consider other sites where it is usual to have bacteria present. So the skin is notorious for having gram-positive organisms, so Staphylococcus epidermidis. In fact, the term epidermidis means above the skin. Other organisms, Streptococcus pyogenes, Staphylococcus aureus, Corynebacterium, Cutibacterium, and there are many other organisms that are not listed. I'm just showing you the most common ones where it is helpful to know, so that when you encounter these in clinical settings, you can make decisions. For example, while these organisms are present as part of a healthy skin flora, if there is a cut in the skin, for example, they can turn into an infection. So you can anticipate which organisms might be causing an infection. In the vagina, Lactobacillus is a healthy microbiome. Sometimes you may find group B streptococci in vagina, which is something that's screened for in pregnancy, because it can lead to complications during pregnancy at birth. Other organisms include Listeria and E. coli. In the mouth, we do have an oral microbiome, so typically Streptococci species and some of the anaerobes, including Peptostreptococcus and Fusobacterium. And this slide is just an FYI, just to show you the essentially the depth of the oral microbiome. So inside the mouth, even at different regions of the mouth, you will anticipate different organisms present. And of course, some of these can lead to health issues, especially when you consider gingivitis and other dental issues that you can discuss with your dentist. And then the microbiome continues throughout the GI system. So the esophagus, for example, has a microbiome. So this is where you will see a lot of the organisms. And by the way, bacteria that belong to the flora in the oral microbiome and esophagus do feed throughout the GI tract. Now, before we discuss the GI tract further, let's talk about the respiratory tract. So as I mentioned, the lung does have a microbiome. So when I say respiratory tract, it starts, pretty much from the nares, so nasopharyngeal area, and goes all the way through bronchi and into the lungs. But the further you go into the lungs, the less likely to have organisms present. So the respiratory pathogens or bacteria, I should say, include Staphylococcus aureus that may be present in the nose, for example, Streptococcus pneumoniae and other streptococci. Some of the gram-negatives include Haemophilus influenzae, Moraxella catarrhalis, Neisseria meningitidis, Peptostreptococcus, and Fusobacterium. And again, the presence of these organisms doesn't necessarily mean an infection. They are part of the lung microbiome, but when you do develop a respiratory infection, these are the organisms that might be causing them. So here's a look at the respiratory tract. So you can see that at the nasal. Again, this picture is an FYI, but you can see that there are major changes throughout the respiratory tract. Of note is that the pH actually increases as you go deeper, which means that, in general, the acidic environment helps prevent the presence of organisms, but as the acidic environment reduces, it creates an opportunity to bacteria to grow. However, there are other mechanisms to prevent bacteria to go deep into the lungs. So there are, for example, coughing and other ciliary movement that prevent the movement of bacteria into the lungs. So you can see that when you look at the density of microbiota, essentially, the numbers increase somewhat as the pH increases. So meaning it becomes a more basic environment as opposed to an acidic environment, but then the numbers drop just because there are mechanisms to prevent bacteria to flow deep into the lungs. Now let's go and talk about the rest of the GI tract. So we talked about oral microbiome and the esophagus. Then once you get to the stomach, it's highly acidic. So a lot of bacteria and other organisms die once they make it to the stomach. However, some organisms can make it through, and pretty much this is highly acidic environment, including the duodenum, jejunum, and the rest of the intestines are all acidic. It's just, the intestines are less acidic, whereas the stomach is extremely acidic. So the number of organisms increase as you go further down. One thing to consider is the lining of the GI tract. So you can see that there is a single layer of a cell that makes up the lining of the gut, and there is a layer of mucus on top of this as a protection, and on top of the mucus is where your microbiome essentially exists. That's where fiber from the diet will come in, and these bacteria will consume it, and occasionally they can make it through the mucus if there is an interruption of the system. And another characteristic of this is that there are microbial communities. So these bacteria essentially live together as part of communities. So they are pretty resilient. So, as you can imagine, the bowel movements that occur, essentially they stick around, and the next time a meal comes in, they are able to reproduce and, digest food and essentially ferment the fiber that comes through the diet, and they continue to replicate. In fact, more than 50% of the weight of feces that come out of the rectum is bacteria, like pure bacterial mass. Now here's a look at as we progress from the stomach all the way through the intestines. You can see that bacterial load increases significantly. Another thing to consider is that oxygen levels actually decrease. So the further you go from the stomach, the more you are going to have anaerobic organisms. And of course, the pH will increase. And again, I will say that although the pH increases significantly throughout, this is still an acidic environment. So there's still going to be pH less than 7. It's just that, in the stomach, the pH is around 2. So it's very acidic. And as you go further down, the numbers goes up, but still is pretty acidic. And of course, there is a layer of mucus on top of the GI lining. So let's take a look at the major organisms in the GI tract. So essentially Enterococcus faecalis, and you can tell from the name faecalis that's, if you can think of feces, Enterococcus faecalis is present in the GI tract. Other organisms include Lactobacillus species, Peptostreptococcus, Clostridium species, E. coli, Klebsiella, and a major one, which is an anaerobic organism, is the Bacteroides species. There is a number of Bacteroides species that are an important part of the GI tract. Now, of course, there are a lot more bacteria that I have not listed here. I have listed here the major ones that are helpful to know when it comes to clinical situations. Now, one thing to note is because there is a large number of species present in the GI tract as part of the human microbiome, it is helpful to think of them as the phylum. So Firmicutes essentially make the large majority of the bacteria in the gut. So as you go down the list here, the abundance essentially decreases. So by far the largest phylum is Firmicutes, followed by Bacteroidetes, and taxonomical naming has changed, but essentially clinically people still go by the old name, Firmicutes and Bacteroidetes. And then there are other classes, and you can see many of these are available as also probiotics, which we will discuss shortly. Now, a couple of concepts to keep in mind is the concept, one is the concept of contaminant. So a contaminant is an organism present in a culture specimen that is deemed to not be the primary cause of infection. In other words, if you were suspecting an infection and you took a specimen from the site of infection, but because it's easy to get that contaminated, meaning bacteria from other places, perhaps the person handling the sample or from other environments make it to the sample, that's essentially the contaminants. And there are techniques that people can use to minimize the risk of contamination of the sample. The second concept is a colonizer. So a colonizer is an organism that is present at the body site but does not normally cause harm or pathogenic effects. In other words, if you were suspecting an infection and you found an organism at the site of infection, that may or may not have caused the infection. So if you didn't think, just because you found this organism, it could have been an innocent bystander, which we call a colonizer. And lastly, it is important to keep in mind that a healthy microbiome is essential for health, which has led people to research the human microbiome significantly in the past few years. So for example, you can think of pretty much different sites in the body, and you can have a balanced microbiome, and then you can have an unbalanced where the microbiome is interrupted and other organisms have been growing in that area. In fact, the most studied part of the microbiome is perhaps the GI tract. So you can see from the esophagus to duodenum, jejunum, ileum, and the colon, there are a number of healthy organisms that we anticipate a healthy person to have. And when we study certain conditions, for example, the most studied include obesity, diabetes, and gut inflammation. These are notoriously associated with gut dysbiosis, meaning that the healthy microbiome has been interrupted and other essentially phyla have become dominant. Which brings us to a few concepts about nurturing the microbiota. So there's a concept of prebiotic. So prebiotics essentially refers to non-viable substrates that are selectively used by host microorganisms and confer a health benefit to the host. This is essentially fermented fiber. So this is the food for the microbiome that's very important to nurture the microbiome. The next concept is probiotics. So prebiotic is the food for probiotics. So probiotics, the definition is live microorganisms which, when administered in adequate amounts, confer a health benefit to the host. And lastly, there is a concept of postbiotics. So if we think there is a health benefit from probiotics, this is essentially through many mechanisms, some of which is thought to be the byproducts that are produced by probiotics. So when probiotics, essentially when they ferment these probiotics, they lead to certain soluble factors that are secreted by these organisms. And they essentially lead to signaling in the human body that will have the actual health benefits in the body. An example of postbiotics include short-chain fatty acids that you may hear about in the news, for example. Now, because of the effects of microbiome on health, there is significant interest in restoring the gut microbiome. So we talked about early in life, for example, through vaginal delivery, That is when the baby gets exposed to a healthy microbiome through the, essentially the vaginal microbiome. And C-section will prevent that. So one idea is the idea of vaginal seeding. So this is specifically for someone who is about to undergo C-section, because they will miss the opportunity of getting exposed to vaginal microbiome. The idea is that an hour before the C-section, a vaginal gauze is collected before the procedure. So this is essentially collecting all the vaginal microbiome. And then the C-section occurs, and once the baby is born, the neonate is swabbed within 2 minutes of birth. So essentially, they swab the face and the back of the baby. Now, there is limited studies on this, so I'm not saying that this is something that's routinely done, but this is something that's emerging. There is, for example, one RCT of infants born by cesarean section that showed that vaginal seeding improved infant neurodevelopment compared with placebo, and more importantly, it showed that vaginal seeding was safe, and the reference is down here. And more human studies are needed for this, but this is a promising strategy. Another thing that people are looking into is the fecal matter transplant. So essentially, for people who have dysbiosis, if you get a fecal sample from a healthy person and you process it to get all the healthy microorganisms, and then you administer it through colonoscopy, for example, to replenish the organisms in the gut. And this has mostly been studied in treatment of Clostridioides difficile colitis infections, but there is also emerging evidence in other conditions through these mechanisms. But certainly more studies are needed. And lastly, of course, what most people are familiar with is the idea of giving probiotics, for example, yogurt, or perhaps probiotics as a pharmaceutical administration. And when you take these along with prebiotics, and again, prebiotics are the food for probiotics, together in the same capsule, these are referred to as symbiotics. And the idea is that, with regular administration, this can essentially restore the gut microbiome. And certainly in this area, there is a lot of studies done, and more studies are needed. And lastly, these are very difficult to study when it comes to any strategy for restoring the healthy gut microbiome, because there is significant individual differences in the microbiota. So if you have two healthy individuals, you're going to have significant difference in the oral microbiome, skin microbiome, vaginal microbiome, GI microbiome. So it's really difficult to define a specific composition of microbiome that's considered healthy, because you're going to have multiple definitions, and what's the right microbiome for an individual, it's a question that's still open for research.